Today we are going to start outbreak investigation. This topic is very, very important from today's point of view. You know that how our world is going and how we are facing problem on day-to-day basis. Okay. So I'm Dr. Aman Kumar, MD Community Medicine, Assistant Professor. Okay. Okay. Uh, what is the meaning of endemic as well as if you see the epidemic? Okay. Epidemic, you know, it's an unusual occurrence of diseases clearly in the excess is the normal expectation. There should be a geographical location and it should be at a given period of time. Suppose large number of area is getting involved if it is epidemic. Look at the graph of endemic. Endemic is constant presence of disease or the infectious agent at a usual level without importation from the outside within a given area of a population. See this graph, whenever there is an endemic, I will show you the full picture in the subsequent slides. If you see endemic slide is endemic graph and the epidemic graph is having completely unusual experiences. Okay, is then not apart from the normal expectation of the population or the disease, the trend of the disease is more. It's an unusual occurrence where is said if at all if it is a constant presence of a disease or infectious agent at an usual level without importation from the outside. This question is being asked so many times that endemic it should be a given area or a population. Coming to the definition of pandemic, pandemic is an epidemic usually affecting a large proportion of population occurring over a large geographical area, such as maybe it's a nation or a continent or the world. You have seen the Wuhan emergence of the COVID-19 from the Wuhan. That was an outbreak. Later, it went to pandemic throughout the world. It spread to first epidemic. There were so many cases of COVID-19 was there, and later it got a spread to all over the country or the world. That is why it is saying affecting a large population size, occurring over a large geographical area. It can include a nation or a continent. Sporadic cases will be scattered out. Cases are widely separated in a space and time. There cannot be or there won't be any connection or there will be little connection of the cases from one place to another place. And maybe you cannot recognize the source of infection in case of a sporadic infection. Look at this figure of North America and the South Africa. Look this endemic disease. Okay. New cases of the disease is dotted point is the new cases of the disease. Okay. And that is the red one, the pink one is of the normal presence of the diseases. See this new cases of disease. If you see the dotted place, endemic means if you see this map of North and South America, you will have some constant presence of dot in each and every places. So that case is endemic. A sporadic, you see, you will get one dot in the South America and one dot in the North America. So cases are scattered here and there, but you will not find. Usually, you will not find any connection. Maybe some little connections will be there, but the cases is scattered. Okay, see this epidemic, one area, large number of cases. Pandemic, see, nation is involving or continent is involving. Both the sector is getting involved, and you can understand easily by the example of COVID-19 how this epidemic occurred and how this pandemic occurred. Now the question is of outbreak. Outbreak is occurrence of more number of cases of a disease than expected. You can correlate that same thing with the epidemic, but the here problem is it should be among a specific group of people over a particular period of time or in a given geographical area. That does not mean that it will be a very large area. It should be a small area. Occurrence of 2 or more any epidemiologically linked cases. Suppose in your area there is no fever case from last 3 to 6 months, but suddenly you have got 1 or 2 fever case. That is also amount to be an epidemic. Suppose your area was not having malaria cases. You didn't get any malaria cases, but recently you have got 1 positive malaria cases. So that amount to be an outbreak. A single case of new emerging disease or the eradicated, it will go to the outbreak. You can link You can link these two words, outbreak and the epidemics. See, these outbreak are usually limited to a small area. It is, I told you, this will be limitation to the small area, whereas the epidemic, when large number of the country or the nation or the continent is getting involved, that will be an epidemic. That is why sometimes questions are being asked, what is the difference between the outbreak and epidemic? Both look similar, but they have a difference that one will be having some kind of a smaller area as a, otherwise uh, uh, and for the epidemic it is larger area. See, this outbreak is usually within one district or in a few blocks. We will get one block or one district will be the epidemic, but for the epidemic usually linked to control measure on a district or the statewide basis. You will have an involvement of the district, more district or the states also. What will be the objective why we want to go for the epidemic investigation? Why to see the welfare of the individuals, to see the welfare of the people. Okay, and from there we are going to establish some objective. We are going to identify the magnitude and the involvement, like how this disease is getting involved, time, place, and person, and will also determine the particular factors, conditions which are responsible for the occurrence of the epidemic, and will also inquire the source of infection or mode of transmission. These are the objective of investigation of an epidemic. Whenever you are going to investigate any case of epidemic, you should know the magnitude, you should know the condition, you should know the source of infection, transmission, and your work is to go for the formulation of prevention and control measures. And which are all the disease requiring investigation? I told you there are some cases of endemic cases with potential of causing focal area outbreak, like I have given example of malaria. Okay, disease under the eradication, so many diseases are there, like poliomyelitis was there. So even if you're getting a one case also, it's an disease requiring an investigation. Recently we have heard in the news that United States of America has got one some case of polio. Okay, rare but internationally important, like influenza or the yellow fever. Influenza every time we are getting an outbreak of unknown disease or the syndromes. What is the purpose? What should be the our purpose of controlling the epidemic? We have to control the control. We have to control the current outbreak. Suppose we got the COVID cases. Recently, we are hearing about the monkeypox disease. Some days back, we have also heard about the Marburg virus outbreak. So many conditions are there. So our purpose is to control the current outbreak. Okay, and whatever we are formulating some rules and regulations. Suppose we have implemented some vaccination into our COVID disease, so that vaccination will prevent the future outbreaks, and that is the way our country is getting less number of COVID cases now. Describe new diseases and learn more about the non-diseases. Okay, and we have to train the health professional. We have to go for the evaluation of the preventive programs, and obviously there should be a participation from the public as well as political. Okay, now the source of information, from where we will get the source of information. Suppose there was a case in Wuhan for the COVID, and we are going to investigate that case. We should have an rumors registers. Okay, to be kept in a standardized format in each institution. Any can be the community informants, like either it should be a private sector or the public sector. Media can also be one of the information. They cannot be completely neglected. Okay, case-based surveillance, you can go see the trigger events and see the review of the routine data. Suppose you are getting an usual number of cases in a few months, and now the cases has drastically increased, then you have to go for the source of information that why the cases is increasing time and again. There are some trigger event. Suppose malaria, suppose polio, plague, jaundice, fever. These are all trigger event. I told you that if you're getting a more than 2 similar cases in a village of 1,000 population, if that village was not having fever, is a trigger event to go for the investigation. Okay. For plague, if rat is falling, if the rat rates are falling, at least probable cases of plague in the community, they are dying, means you should be alert and you should investigate that thing also. Polio, even a single case will trigger outbreak investigation because we have received a certification from the WHO. Even we are getting a single case, that is a point of investigation. Malaria, early warning signs, wherever you are seeing this, like 2 or more linked cases of any, if you're getting a measles, cholera, dengue, Japanese encephalitis, every time you are getting a high number of cases of dengue in Delhi, even though in for the cholera also, this is important. These are all early warning signs. One more thing, whenever you are finding any places, if you are finding a high vector density, you will again have to investigate that, and that is an early warning sign. And to find out the high vector density, you will think that how it will be done. It is done through the GPS system. The level of responses, I am telling you, if it is a pandemic, it has to be go to the international level of response. Like WHO have to get involved into it and give the media briefing that this is an international pandemic situation. When wherever you are going for the confirmed outbreak or the outbreak, local or district responses should be there. Somewhere a state has to get involved. If at all there is a wide stress of epidemic or the natural disaster is there, the states are getting involved. Even the Minister of Home Affairs is getting involved in case of natural disasters. This is important. Steps of outbreak investigation. There are some 10 steps. One by one, we are going to discuss all these 10 steps. Okay. Prepare for the field work. Preparation for the field work. If you see, you have to go for the investigation. I have told you, involve the administration level. Unless and until you are going for the you are going to investigate any outbreak, if you are not involving in the administration, people will not cooperate in that particular area. And the consultation, you have to assign each one a role. You have to prepare a team of clinician, epidemiologist, microbiologist, lab workers should be there, lab technicians should be there, environmental health specialist, suppose malaria cases there, you should take entomologist there, local health department, and you have to concern with the other health state agencies also. So you have to prepare for the first field work. So these are things that administration is to be involved completely. You have to prepare an outbreak team. You have to go for the investigation. What are all equipments are being needed in those area, and you should have a scientific proof or the scientific knowledge wherever you are going to investigate that particular case. Sometimes the cases are new to us, and we do not have that much knowledge, scientific knowledge about that particular cases. So it takes a lot of time to diagnose and come to some conclusion level. You can take an example of COVID only, that we were not knowing what is the exact mode of transmission. We were giving some kind of theory. One day we were giving what the formats, so that day we were giving what the droplets. But somehow after 1.5 year, 2 year, WHO confirmed that this could be a droplet infection. If you see, before leading for the team leader should ensure that you have to verify the rumors and collect the preliminary information from the local area, and you have to send that information to the central health authority in the affected area. Or you can go through the email. You should have the written document or the written permission from the central authority before you are moving for the investigation. Make necessary technical, administrative, as well as the logistic arrangement, because if you are not going with the administrative, people will not cooperate. And as per the preliminary information, you have to prepare an outbreak management kit. Where whatever the cases you are getting, you should give some treatment to them. That's what we did in the COVID phase also. Government was having some kind of management kit, and people who are getting the COVID, they were sending by post medicines and all. And brief members of rapid response team on the purpose and their role. You should tell them that what for you are going. As suppose you have taken microbiologist, you should explain the microbiologist. Suppose you have taken the entomologist, you have to explain the entomologist, and there should be one leader among them. And establish the existence of an outbreak is the second step. Okay, you have to first make the provisional clinical diagnosis by examining, okay, whatever the cases you have got, or if at all the cases recovered, you have to go and you have to talk to them, and you have to find out the causes, like what went wrong. Okay, on the basis of clinical profile and the case record, develop a working case definition. Suppose you are getting a fever, so you have to develop a fever. uh, we um, we have seen the COVID era also, that whoever is getting a fever, cold, cough, will go will investigate that person and will ask him to go for the antigen test or the RT-PCR test. So we are developing working case definition after talking to some people in that particular area. Okay, and to help in establishing the diagnosis, you have to collect adequate number of the clinical sample, and you have to send that sample to the lab by filling the laboratory form so that it should not get mismatched. Okay, you have to take the sample of recovered cases also. You will get some finding from the recovered cases also, if there is lot of mutations in that particular organism. Case definition, I told you, go by the clinical information about the disease, characterize information about the location of the place, what place is getting involved, a specification of time during which the outbreak has occurred. Okay, a standard set of the criteria you have to put into your checklist, that what all points I have to cover, and make some go for some case definition. This case definition is not exact. You cannot suppose during our COVID time also, we were changing from time to time, because this is an outbreak, this is an epidemic. We were not having any idea about the COVID-19. Lot of suffering was there, but still people manage that. Okay, whenever you are going for the suspected cases, have fever or any, you should have some clinical features. Okay, atypical clinical feature. But if you're finding a typical clinical feature of illness, you should put that particular case in probable cases. But if you're confirming that clinical features with the laboratory investigation, you confirm that case as a confirmed. Okay, you give a confirmation that this was the case. You have to divide this into three. Suspected, suppose non-blood diarrhea without microbiologically confirmation. Okay, probable case, bloody diarrhea. Okay, without microbiological confirmation. But if you're having a laboratory finding, if you're isolating outbreak of the bloody diarrhea, suppose E. coli 0157H7, okay, is an isolated from the stool culture, you should confirm that this is the positive laboratory findings. So that is why you are dividing these cases from your working case definition and the confirmed cases. See, there are a lot many cases in the society, but we are getting few cases which is coming to hospital. Okay, and whatever the we have to confirm the existence of an outbreak, you have to review the clinical as well as the lab records. Okay, epidemiological linkage. You have to go back and trace 2 to 3 years back. Go back 2 to 3 years back. Okay, see the findings, see the registers, what all cases was coming, and if you are having any notifiable disease, if you're finding it, confirm and report to the government of India. Next thing is verification of diagnosis. I will diagnose the, and you have to verify first. Okay, I told you, if you are having a suspected case, confirmed case, probable case, you have medical examination team, you have lab investigation team, and you have epidemiologically investigation team. So you have to cooperate with each team, and you have to tell them what has to be done. Okay, do not leave any investigator in a single hand, that he will do something and he will bring means you should not disturb the monogram. Okay, so hierarchy should not disturb. You have to go for the physical clinical examination, lab examination, and epidemiology part, epidemiologist will do. Define and identify cases. How you will identify the cases? You have come to diagnosis, but how you will identify the cases? You have to line list the cases. Everywhere, every institution was line listing the cases. What they were doing, it's like a nominal role of the cases being reported to the various healthcare establishment. All the medical institutions or the district hospitals were preparing COVID cases list. That was the line list. Okay, and uh, daily we used to send twice to the government of India those reports. Okay, so in the evening or in the night, government of India, they used to give some data that 3 lakhs, 4 lakh, 1 lakh cases has we have got new cases of COVID on this particular date. So what we are doing, we are collecting information, name of the patient, socio-demographic profile we are collecting. We are taking the date of onset of illness, symptoms, what was the symptoms, and what treatment was given to him, whether he has recovered or not. So this is the line listing. Later on for the COVID-19, what government did, they made a software that we have to upload all the data into that software so that it will be easy to communicate for the country. Management of cases, you have to manage cases appropriately with the help of clinics facility, and we have to prevent the deaths. Okay, cases should be managed in isolation to prevent further transmission of infection. That is why in the outbreak investigation, they have clearly mentioned that whenever you are treating a case, confirmed case, you have to isolate the patient. Okay, and whenever you are getting a suspected, you have to quarantine that patient and ensure medical logistic sufficient quantities of essential drugs and supplies should be there from the department. Again, one more point, how we'll do the survey. The survey team will go to door survey in the affected area and ask if any person has suffered with the symptoms, that is known as the rapid household survey. If yes, take their details, record in the epidemiological case sheet, and required samples to be taken, and you have to send that particular sample to the hospital for the lab examination. You see this form, the suggested format for the rapid household survey, so that you will take the cases from the household also, and you will isolate those cases. That is why what we were doing, we were going and collecting the samples from the house to house. Wherever we were getting any cases around that area also, we were going and collecting. That is whatever we were following during the COVID-19 cases was all is in the guidelines of the outbreak investigation, and each and every point was being followed as per the protocol. Entomological, environmental, or the zoonotic diseases, you have to collect data on the rainfall, humidity, temperature. Lot many times we were telling that this is uh, summer season, COVID is high, maybe it will get reduced in the winter season. Okay, large humidity, any man-made situation, drinking water supply, we were checking each and everything from where it is getting arised, and we were maintaining the hygiene level also to check that. Describe an orientation of the data, distribution of time. You have the two types of outbreak. One is common and one is propagated. In case of common outbreak, if you see the common source outbreak, you have single source and the continuous or the multiple exposure. See, this point source is sharp rise or sharp fall in the number of cases. Okay, clustering of cases in the narrow interval of time. See, this graph is of point source origin. Suppose there is a food poisoning. Food poisoning is from the common point source. Okay, sharp rise or sharp fall. If it is a continuous common source, sharp rise in the number of cases for the long period of time. See, this long period of time is there. Okay, fall in if you see contaminated well in the village, if there is a well in the village and everybody is drinking water from there, and you have the outbreak. Why? Because of food, or uh, because you are using that water in the food, you are using that water for the drinking purpose. That is the continuous. If you see propagated source, there is a gradual rise and gradual fall over a long period of time. See these dates. You have seen the TB cases. Recently, government has introduced National Strategic Plan NSP 17 to 25, and the notification rate of the tuberculosis has decreased a lot to 188 right now because of this gradual rise and gradual fall over a long time. Okay, that is why the tuberculosis, HIV cases, and hepatitis. If you see this distribution of the place, this is a spot map, a small spot map diagram. Okay, whatever the point is there, that the square is the pump side. Okay, and there is a death from the cholera. There is in 1854, it's a Golden Square, it's a very famous case. In 1854, Golden Square district of London. Okay, that was the cholera was the epidemic at that time. Nobody was able to find out. John Snow. He was able to focus attention on the common water pump in the broad street as a source of infection. That maybe this problem is because of water pump. Okay, that is the cholera epidemic. If you see this, everything is surrounding around the well is the red mark, red color round mark is there, and all the cases are surrounding that square. Whenever you are going for the distribution of the cases, suppose a lot of time this question was asked in the your NEET PG, what is the index case? Okay, this index case on the epidemic curve is the first case on the epidemic curve is the index. It is important with the possibility that he or she brought the infection to the community. That is why that's the index case. Okay. Outlier case is the cases which appear at the beginning of the curve and at the end of the curve. I am not talking about the peak. Okay. And they provide information about the source and the way of a spreading into the territory. That is the index case is first case always, which maybe we think that that particular case, the first case brought that case into our community. Like for the COVID virus, we thought some person is coming from the abroad, got into Jaipur or Delhi, they got the first. That was the index case for us. We, after getting all this thing, all the information, we have to develop the hypothesis because we have done the data collection, we are confirmed with the diagnosis, we know the lab reports, everything. We are having the line listing of the cases also. Now, suppose a supposition made from the data analysis and interpretation, you go with the population, what was the source, what was the environment factor, and maybe you can consider what you know about the disease itself, or talking to few of the case patient, you have to generate the hypothesis, and the descriptive epidemiology may provide a useful clue that can be turned into the hypothesis. Going for the evaluation, compare. If you're having a comparison of this thing, you know that we are going to use the case control in case of analytical epidemiology, okay, and the cohort study. We have to fix this thing into one particular area, okay. Best technique for analyzing an outbreak in a small and well-defined population, where we are going to use the cohort study. Case control study is very long period, so people avoid that usually. But best technique for analyzing the outbreak in a small or the well-defined population is the cohort area. Why? Because they calculate the association between the exposure and the illness is the called relative risk. With respect to case control, we are calling it that as a odds ratio, and where the population is not well defined. Okay. For the smaller population, we were using the cohort study, but for the larger, we are going for the case control study, odds ratio, and final step in the testing hypothesis to determine how likely it is that your study results could have occurred by chance alone. Looking to the odds ratio, if you're going for the exposure and the disease, there is a high chances, because odds ratio is having, it is helpful in evaluating the possible vehicle of the disease, because it gives the strong association if the value is more than 1. Refining of the hypothesis, you have to see that whether it is analytic epidemiology is there, studies there is not. Okay. Even when an analytic study identifies an association between exposure and disease, you often need to redefine the hypothesis. Sometimes need to obtain more specific exposure histories. When an outbreak occurs, whether it is in routine or unusual, you should consider that question. Whatever the question is being remained and unanswered about the disease, and what kind of a study you might use in that particular setting is that important. Why? Because we are having case control, cohort study, randomized control trial also, and the cross-sectional study also. And whenever we are putting some vaccination drive, suppose we have received the vaccination drive, that also can be a point of evaluation. Implementing control and the prevention diseases, you have to institutions, you have to go for the control measure. Okay, based on the epidemiological findings or entomological finding, you have to go for the control measure. You have to manage the case. Okay, and institution of control measure in the management of patients should not be delayed pending lab confirmation for the diagnosis. Control measure, elements of epidemic control, which includes controlling the source, interrupting the transmission, and modifying the host response. How doing this in this COVID period. Step 10 is communicate the findings. To whom you have to communicate the findings? First of all, to whom you have to communicate the findings. Okay, you have to give the daily updates. Like we were preparing the list. Okay, line listing. We were doing the cases, and during the period of the outbreak, nodal medical officers should continue to give the daily situation update about the outbreak to the next level. Suppose medical college and giving information to the district authority area. District authority area is going with the state, and the state is forwarding that particular thing to the central area. And this should continue even the in epidemic investigation team has a strategic investigation. They have to update and include the list of new cases, lab results received, and any new findings. And you have to continue till the end of the outbreak. So you have to daily you have to report to the authority. Reporting should be done. You should have a blueprint for the action. Okay, daily interim reports and the final reports should be done. See this format of reporting or outbreak investigation report. See this report to be submitted by the investigating officer or the team to the next higher authority within 1 week of completion of investigation. You have to report that if you are going for the outbreak investigation, you have to report within 1 week. Okay, and if you're line listing the cases, both the things are different. This is an reporting of outbreak. Both the things are different. And if you are receiving the cases, you have to immediately by the afternoon or by the evening, you have to report to the district authority. And district authority in turn will go to the state, and the state will in turn go to the center. Declaring whether this outbreak is over or not. This is a role of district surveillance officer. Every time we will be finding some other surveillance officer. Okay, so if you are getting no new cases during the 2 incubation period since onset of last case, this, you remember this, it should be 2 incubation period since the onset. It should be 2 incubation period since the last case. Okay, last case, if you have received the last case on suppose 15th of July at least, and the incubation period of that particular disease is 7 days. So at least you should wait for the 15 days to declare that the outbreak is over. It implies careful case search to make sure no cases are missed. Okay, you have to declare. When you are going to declare, and who will declare is the district surveillance officer is going to declare. Follow-up of the outbreak, detect the last case, detect and treat late complication, complete the documentation of the outbreak, okay, and report to the center. We are going to discuss some recent outbreak. Recently, we have got one case of monkeypox outbreak. United Kingdom got some case from the Nigeria, and in India also we have received today's news. They said that we have received one case of monkeypox in India also. If you go to the WHO website, there is disease outbreak news column. Disease outbreak news column. Daily they are updating. If you see there, that this on 27 June, multi-country, there was an involvement of the monkeypox outbreak. 4 July, there was an Ebola virus disease in the Congo. 12 July, it's an acute hepatitis against a multi-country. 20 July, there was an outbreak of the cholera in Somalia. And today, 22 July, 2-3 days back, it's a Marburg virus in Ghana. See this timeline again. For 10th July, 10th June, monkeypox again. Okay, 10th, 17th, monkeypox. So in monkeypox virus first arrived in the May. Okay, in the May. If you see the data, it's 29 May. Okay, it came from the Nigeria. Later on, it is getting involved to, it is getting transferred to the multi-country, and including India, we have received one case of monkeypox. There was a bird flu outbreak in Tripura. Okay, and you see this number of control of outbreak in the disease for the period 7 to 8 and 13 is fever, diarrhea, food poisoning. Lot many cases were there. You see this district wise, wherever this food poisoning is there on the map, you see, if you see the Pune suffered from dengue. Delhi, every time we are getting an outbreak. Kullu area nearby Manali is food poisoning. So many in Bangalore, we also received urban area, we have the food poisoning. Coimbatore, food poisoning. Okay, Salem, dengue. Nellore is acute diarrheal disease. West Champaran, chickenpox. It is being reported from the second week of 2012. Encephalitis, there was an outbreak of the encephalitis. We have an encephalitis outbreak area is Uttar Pradesh, Bihar, and the West Bengal. Okay, so again, 25% of the cases did not survive this deadly infection. So that is again an encephalitis. They are affecting mostly the young children of 15 years of age. So these three places of UP, Bihar, and the West Bengal is affected by the Japanese encephalitis. Going to the hepatitis B infection in the Gujarat, cause of infection is caused in the liver, and it was going for the hepatitis, and it can be prevented by hepatitis B vaccination drive, and we are immunizing a lot many people with the hepatitis B infection, and that time we had received a case of 49 death was also reported from the hepatitis B in Madosha in Gujarat. It's a Western India in 2009. Okay. Chikungunya was also an outbreak in so many areas in Karnataka and Maharashtra in 2006. There was 1.25 million suspected cases from the country. It's a vector origin, it's a Aedes aegypti. Okay, Chikungunya was there. Looking into the Ebola virus, Sierra Leone was the first West Africa outbreak of Sierra Leone. That was the Liberia. It transferred to Liberia, Guinea, and Nigeria. Later on, it transferred to other country also, like Uganda, Zaire, Sudan, Republic of Congo. Okay, this is all from my side. Thank you so much.